Alright, this is the head to toe video for Dana Rosansky. I'm filming with Katie Shipley, and I'm just going to scan the room to show you that it's empty. All we have here is the laptop, which is off. We're just using it to hold my phone up as a stand because we're recording on my phone. Okay. Entering the room. Hi, my name is Dana. I'm going to be your nurse today. I'm going to close the curtain for privacy, and I'm going to wash my hands. Can I check your wristband?
Mm-hmm.
Can I have your name?
Katie Shipley.
And your date of birth?
2/24/93.
Okay. Any pain today?
No.
And any allergies I should be aware of?
No.
Meds or latex? No?
Mm-hmm.
Okay. And you know where you are?
The hospital for a checkup.
Okay. And you know the date?
October 19th, 2015.
Okay. So the patient is alert and oriented ×3. She appears her stated age. She's clean, well kept, dressed appropriately for the situation. There's no immediate signs of illness or injury that I need to approach right away, so I'll continue with my assessment. Her speech is clear and appropriate, and she appears to be in a good mood. She's smiling. Alright, so I'm going to start by looking up at your face. Your skin is appropriate for your ethnicity. I'm going to have you take your glasses off for me. Your eyes are symmetrical. I'm going to check your conjunctiva. Conjunctiva are pink, which is what we're looking for. Now I'm going to use my pen light. I'm going to have you look straight forward. And now I'm going to have you follow my pen to your nose with your eyes. Okay, so the patient's pupils are equal, round, reactive to light, and accommodating. I'm going to have you open your mouth for me. Okay, the inside of the patient's mouth is pink, no lesions present. Can you smile for me? Her teeth are straight and white, and her gums are not bleeding, and there's no signs of a receding gum line. Now, if you open your mouth one more time for me, say ah.
Ah.
Uvula rises on phonation. The patient's tongue is pink in midline, and her tonsils are 2+ bilaterally with no discharge present. Alright, now I'm going to check your carotid pulses separately so as not to cut off your circulation. Okay, the carotid pulses are 2+ bilaterally. Now I'm going to listen with my bell for any bruits. Okay, no bruits present. The patient's face is symmetrical. I'm going to have you smile and puff your cheeks. Frown. Okay, cranial nerves 5 and 7 seem to be intact. Alright, so now I'm going to check your upper extremities. Your skin tone is even throughout, appropriate for ethnicity. It's of the appropriate temperature, not too warm, not too cold. No lumps, bumps, or lesions present. I'm going to check your radial pulses. So can I see your wrists? Okay. And the radial pulses are 2+ bilaterally. Now I'm going to assess your brachial pulses, which are up here. Patient's brachial pulses are also 2+ bilaterally. Can I see your fingers out like this? Checking capillary refill. Okay, that's appropriate. Refills within 3 seconds. There's no signs of clubbing on the patient's nails. And I'm going to have you grab my fingers. Okay, the patient's hand grasps are equal bilaterally, so equal muscle tone. Now I'm going to listen to your heart sounds. We're going to start using the diaphragm. I'm going to start at the second intercostal space on the right-hand side. That's the aortic area. Normally we would be listening under the patient's clothes directly on the skin, but for this purpose we're going to stay above the clothes. And in the aortic area I'm hearing S1 sounds. I'm going to move to the second intercostal space on the left-hand side. That's the pulmonic area. Here I'm also hearing S2 sounds. I meant to say S2 sounds for both, the aortic and pulmonic. Now I'm moving down to the Erb's point, which is the third intercostal space at the left sternal border. And here I'm hearing both S1 and S2 sounds. Now I'm going to move down to the tricuspid area, which is the fourth intercostal space on the left sternal border. Here I'm hearing only S1 sounds. Then I'm going to move to the fifth intercostal space at the midclavicular line on the left-hand side, and that is the mitral area. And here I'm hearing S1 sounds. And I would also listen for 1 minute for the apical heart rate. Now I'm going to flip to the bell and I'm going to listen in a backward Z to all the same areas for any murmurs, starting at the mitral, tricuspid, Erb's point, pulmonic, and aortic. So no murmurs are present. Okay, now I'm going to assess your lungs, so I'm going to listen the front, back, and on the sides. I just want you to breathe normally for me. I'm going to use the diaphragm for this. And again, I would be doing this normally right on the skin. Okay, so in the front I moved in an hourglass shape to listen to all parts of the lung. I heard tracheal sounds, no adventitious sounds. I'm going to have you lift your arm for me. I'm going to listen to 2 areas on each side. Okay, other arm please. Okay, no adventitious sounds noted, all vesicular. Now I'm going to check 10 areas on your back. I'm going to stay close to your spine and move all the way from the top to the bottom. Okay, no adventitious sounds noted and all bronchial vesicular sounds. So all the lung sounds were clear in all fields. Now I am going to have you stand up. I'm going to assess your CVA tenderness. Okay, so I'm just going to hit her lower back. Tell me if you feel any tenderness.
Nope.
Nothing? Okay, and now I'm going to have you bend over. Okay, her spine is straight, no abnormal curvatures. And I'm going to check your AP diameter, that's 2 to 1, which is what we're looking for. I'm going to have you lay down for me. I'm going to check your stomach. We're going to listen to all 4 quadrants of the abdomen using the diaphragm. I'm going to start in the right lower quadrant. We'll start in the right lower quadrant. This is where the cecum and the appendix are. We're going to move to the right upper quadrant, which is where we have the liver and the gallbladder. Now we're going to move to the left upper quadrant, which is where we have the spleen, and the right lower quadrant, which is where we have part of the descending colon. So bowel sounds are active and present in all 4 quadrants. Now I'm going to percuss in all 4 quadrants, and I'm hearing tympanic sounds on the hollow organs, which is to be expected, and dull sounds on the dense organs, which is also to be expected. I'm going to have you, I'm going to palpate for any tenderness in all 4 quadrants. Let me know if you feel anything. Anything? Okay, so no tenderness noted in the abdomen. I'm going to have you sit up. No jugular vein distension noted in the patient's neck, so that's good. Now I'm going to check your lower extremities. Normally we'd be looking directly at the patient's skin. Skin tone is even throughout and appropriate for ethnicity. No lesions, lumps, bumps, or edema present. The skin temperature is appropriate, not too warm, not too cold. I'm going to assess the popliteal pulses, which are right under the kneecaps. And those are 1+ bilaterally. I'm going to move to the tibial pulses, which are right in here. And those are also 1+ bilaterally. And then the dorsalis pedis pulses, which are down here, the top of her foot. And those are 1+ bilaterally as well. I'm going to do the Babinski test. That's negative, no curling of the toe or fanning of the toes. I'm going to have you stand up for me. We're going to perform the Romberg test. So I'm going to have you keep your hands to your side and close your eyes. I'm going to stand close to the patient so she doesn't fall if she gets unsteady. I would have her stand like this for 30 seconds, and if she doesn't have any dizziness or unsteadiness, the test is negative. So we're going to assume the test is negative for this purpose. And I'm going to have you walk to the end of the room and back. Okay, I'm assessing the patient's gait. The patient's gait is steady and straight and unassisted. So that's what we're looking for. So that would be the end of our assessment.